Good morning, everybody, and welcome to the Virtual Village Hall. Thank you so much for being here with me this morning, and thank you to the Royal Voluntary Service for having me. So I work as a doctor in television. You might recognise me if you watched This Morning. I've also presented TV shows for the BBC and occasionally do radio, and I write a column for the Sun newspaper as well. So lots going on. But one of my real passions within health is around lifestyle medicine. So I'm one of the directors of the British Society of Lifestyle Medicine, and I also work for the Royal College of GPs as a clinical champion for physical activity and lifestyle. And physical activity is kind of my specialist subject, physical activity and how it relates to health. So I'm delighted to be here today to talk to you about how physical activity can benefit your mental health and well-being. The things we'll talk about, we're going to define what is physical activity, because if I was to ask you that question, what is physical activity? I'd probably get lots of different answers. How much ideally should we all be doing, but actually how also very small amounts can really benefit you. I'm talking about how physical activity can protect our physical health, but also really important for mental health and well-being. And if you're up for it, we might get into a bit of the science as well. So a little bit of a science lesson. I think it's always important and helpful, rather than just, we all know that physical activity and exercise is good for us, but if we can understand some of the statistics and a bit of the science as to how it's actually working, I think that can be really motivating. And then at the end, I'm going to hopefully give you some ideas as to how you can get started. So I want to invite you all now to, we'll do a bit of maths. So the maths is going to become before the science. Just have a little think about how many times a week do you participate or engage in some form of physical activity. So that's not going to the gym or going out for a run. It could be walking, it could be hoovering, it could be playing with children or grandchildren, it could be walking back from the shops carrying shopping bags. The definition of physical activity is actually anything, let me just check that, any bodily movement that requires energy expenditure. So generally, if something involves you moving, especially if it means it gets your heart rate up and gets you breathless, then it counts. So how many times a week do you do something that would be classed as physical activity? And then on average, how many minutes do you do it for? And then I want you to add those two numbers, multiply those two numbers together. So if I take myself as an example, and I just think about my commute to work, I probably do about a 20-minute walk, both directions. That's 40 minutes, and that's would be 5 times a week, say. So then I'm going to multiply those together. 5 times 40 is 200. So give yourself a number, put it in the comments, and then I'm going to have a little look to see what people are saying. And then we'll talk about actually how much physical activity is recommended in the guidelines. So just to recap, how many times a week do you do some physical activity? And on average, how many minutes would you do it for? And the other thing I want you to just think about, you can put it in the comments if you want, but mostly just think about is, how do you feel after you've done that physical activity? Even if it is zipping around the house with the Hoover with some music on, or whether it is something more exercise based, how do you feel afterwards? Then we'll be reflecting again on that a little bit later on. So, some very high numbers coming through actually. Some very active people, which is great. So I'm going to show you some slides now. I'm going to talk about the guidelines, and we're going to get into that science, and hopefully you'll find it interesting. So bear with me one moment whilst I just share my screen. Okay. So The UK Chief Medical Officer's guidelines around physical activity, they're quite complex. There are a few various different bits to it, but the thing that comes up top is muscle strengthening activity at least 2 days a week. And I can't tell you how important, especially as we get older, muscle strengthening activity is. We start to lose our muscle mass from the age of 30, just 30. And by the time we get into our 50s and 60s, that muscle loss accelerates. So if we don't use it, we literally lose it. And muscles are really important for a number of reasons. Some people quite like how they look. That's not about health, but fine. But they're really important, obviously, for our skeleton, so for our strength, for us to be able to do the things we want to do. But they're also really important for our metabolic health. And I'm going to talk a bit more about that later on. So muscle strengthening activity. And it was a few years ago, it was 2019, the chief medical officers, when they sort of revamped these guidelines, they decided to put that one first, because often people think about the aerobic exercise they do, but forget about the importance of muscle strengthening. So the next bullet point there is 150 minutes of moderate intensity activity, or 75 minutes of vigorous, or a combination of the two. First thing I want to say about that is 150 minutes can sound like a lot for some people, especially people who are doing nothing or doing very, very little. So the guidelines, a caveat always with guidelines is, a guideline is something to work towards. If you're not achieving it, if you're never going to get there, you mustn't think, oh, therefore I won't try, because especially with physical activity, the more you do, the better, but even very small amounts of physical activity can make a difference. We used to talk about a dose of 10 minutes being the minimal dose that was necessary to have health benefit, but even that's been abolished now. If you can do 1 minute of movement that you weren't doing before, then there's a benefit attached to that. So 150 minutes is fantastic. In fact, even if you can do more, even better. But if you can go from doing nothing to doing 1 minute per week, then there's a health benefit. And then minimizing sedentary behavior. So spending lots of time sitting down is really bad for our health. Even if you're somebody who's quite active, if you then spend 8, 9, 10 hours, which is the average per day, sitting, then that is also harmful for your health. It's important to keep moving regularly throughout the day. And that's where that 10,000 steps is really helpful, because if you're managing to do 10,000 steps, then the likelihood is that you're moving regularly throughout the day. And for older adults who are over the age of 65, also it's really important to incorporate balance and flexibility activities at least 2 days a week. And that's really important for maintaining balance, reducing the risk of falls, maintaining independence. And again, towards the end of this talk, we'll talk a little bit more about some ideas for things that you can do for that. So it's quite a complex guideline, but it's important to give you that information at the start, because this is essentially ideally what we're working towards for good health. And the infographic that you can see there, these infographics are available to download online. If you just put Chief Medical Officer Physical Activity, they'll come up online. And there are some other infographics here as well. So there are a whole range of infographics that I was part of an expert team that was involved in putting some of these. I wasn't involved in all of them, but putting some of these together several years ago. They're really helpful for me as a GP to use with patients. But I think they're just really helpful for people to have as a reminder of what sort of physical activity we should be doing. So there you can see there's an infographic for pregnant women, for women after childbirth in the first 12 months, for young children, for children aged 5 to 18, and also for physical activity for disabled adults. Okay, right, quiz question for you. Physical activity reduces the risk of which of the following conditions by at least 20%? And to give you a bit of an idea as to what I wonder how many people watching this are either taking a statin to lower their blood cholesterol, or have been recommended that they take a statin at some point. And generally, as doctors, if taking a statin will reduce somebody's risk of having a heart attack or a stroke by 20% or more, then we're likely to recommend taking a statin, or certainly to consider taking a statin. So therefore, thinking about that 20%, being active over the course of your life can reduce the risk of which of the following by at least 20%. So if you want to have a go at answering that, you don't need to answer in the comments if you don't want to, but have a little think. Do you think that being active can reduce your risk of all-cause mortality? So essentially that's premature death by 20%, breast cancer, depression, coronary heart disease and stroke, colorectal cancer, bone fractures, hypertension, high blood pressure, or a reduction in cognitive functions, thinking about dementia. How important. And I wonder how many of you actually thought that it's all of them. It is all of them. It's all of them and more. And when I look at this slide, I always think, imagine if we did have a pill that could do for us what physical activity can do for us. And this is, going by the guidelines, if we say it's 22 minutes a day of brisk walking can reduce your risk of type 2 diabetes over the course of your life by 35%, by having high blood pressure by a third. And today we're talking about particularly about mental health and mental well-being. So the stat on there that's particularly relevant is depression. So being physically active may reduce your risk of depression by almost 50%, which is huge, because when we think about physical activity, it is available pretty much to all of us in one form or another. It is free if we want it to be. It doesn't necessarily require any equipment. And the great thing about physical activity, when we compare it to drugs, is that it doesn't have any negative side effects. In fact, it has a whole host of positive side effects. It's not risky. It is safe as long as we take the necessary precautions, which again, I'll talk about later on. So therefore, if this was a drug and we could bottle it, I would give it to everybody that I know and I would take it myself. But, we do all have this available to us. So it's one of the best things we can do for our physical health and for our mental health. But how else does physical activity improve mental health and well-being? Well, there's a long list of things there. It can give us that real sense of achievement. I asked you earlier, on the days that you do some physical activity, how do you feel afterwards? You might feel just good about yourself, proud of yourself. It can be a distraction from all the things that are going on in our lives. It helps. One of the other 5 ways to well-being is around mindfulness. And I know personally that when I'm out running or doing a yoga class or doing an exercise class over Instagram or something, I am really present in the moment for that 20 minutes, 30 minutes, 45 minutes, and all the stresses and strains and worries of what's to come and what has passed leave me for that period. So, it's really good for a really good distraction. It can be a relief for pain. It can be a really effective pain relief. Helps people to sleep better. We know that sleep and poor sleep is very, very closely linked to our mental health and well-being. And exercise, and especially earlier on in the day, can really help improve not just the amount of sleep we get, but the quality of sleep. Can get us outside our home. It's a great way of connecting with other people. Again, one of the 5 ways to well-being. Can help manage cravings and withdrawal symptoms. Can help us improve and maintain mobility, which is really important, especially as we are getting older, and it can be great fun. So lots of additional ways in which physical activity can help improve and maintain good mental health and well-being. But I want to talk a bit about the science and the evidence and what do we actually know and what's the emerging evidence. So as a scientist myself, these are some things that I find really interesting, and I hope you will too. So thinking about mood improvement and physical activity, so some possible sort of scientific mechanisms that are being tested and being looked at. The first one there is the biological effects of physical activity on our brain and on our body. And I think one of the things people often talk about is the endorphins. When you exercise, you get a release of endorphins into the brain. It's actually something that the scientists are questioning at the moment, whether that really does happen. But, there's no denying that for most people, you do feel great after you've exercised. We know that exercise can actually change the structure of the brain, so the neurons, the millions, billions of nerve cells that we have in our brain. We can actually change the structure of our brains if we regularly exercise. The hippocampus, which is a really important part of the brain, studies have shown that even with small amounts of exercise, that part of the brain, the volume of it can get bigger. And then this idea of systemic inflammation, which I am going to talk about in more detail because it's fascinating. And this is about inflammation. It's a normal response to stress or danger. So if you sprain your wrist, you'll get an inflammatory response, and that's all very well. It protects you. And as human beings, we're designed to have acute inflammatory responses every now and again. But we live in a world now where what we are experiencing is this, what we call low-grade systemic inflammation. So that's a low level of inflammation, but it's throughout the whole body. And as human beings, we're not designed to have that. And that is really dangerous. It's thought to be the root cause of a lot of the common diseases that we're suffering from: heart disease, some cancers, type 2 diabetes, very closely linked with obesity, and very closely linked with mental health conditions. Stress of the body, this systemic inflammation, is very closely linked to emotional stress as well. And essentially, it's really, really bad for us. And exercise is thought to reduce that systemic inflammation. And I'll explain why very soon. A couple of other possible mechanisms. Number 2, buffer effects. This is really interesting. I'll tell you about a study that was done in firefighters in Austin. They took a large group of firefighters and they separated them into 2 groups. One group did a 16-week exercise program where essentially they did rowing on a rowing machine, and the other group didn't. They just carried on doing whatever they were doing before. And then after the 16 weeks, they got these firefighters to do the simulated fire scenarios that they do over computers, and they watched what happened in their bodies and in their brains. And what they found is the group that had been subjected to the exercise program, they were less likely to raise their heart rate. They were less likely to raise their blood pressure as much. And they actually reported that the stress and anxiety they felt doing that simulation was less than the group who didn't do the exercise, even though at the beginning of the experiment, before the exercise, the 2 groups were the same. So this is what's called a cross-stress adaptation hypothesis. Essentially what that means is, as your body gets used to the stress of exercise, because exercise does put your body under a bit of stress, but it's good for it, it's more able to deal with other stresses, including everyday stresses. Another thing you might have heard about is cold water swimming. It's getting very, very popular. It's absolutely not something I would recommend somebody dive straight into an icy cold sea, especially if you have a heart condition. But it is something that there's a lot of emerging evidence. And if it's something you want to try for the first time, what I would recommend is gradually reducing the temperature of your shower so that you can start to get used to colder temperatures. Cold water swimming is what people love to do, but actually having a cold shower does the same thing. And what it's been shown is that people who start doing cold water swimming, the first time you get in cold water, it activates your fight or flight response. So your heartbeat will go faster, you'll have a surge of adrenaline. It's quite an unpleasant experience. But after 6 times experiencing that, the stress response is halved. And the importance of that is that your stress response halving to that particular scenario, people then seem to have a lower stress response to general, normal, everyday life. That means the systemic inflammation we're talking about can be lessened. So that, it's really interesting. And we don't really have any definitive data yet, but it's looking like it may actually reduce the risk of some chronic diseases, but certainly people report that it helps with their mental health. And then the third one is changes in stress sensitivity. So this is the more obvious symptoms. If you're exercising, particularly if you're pushing yourself, if you're doing vigorous exercise, if you're getting out of breath, your heart's beating faster, you become aware of your heart beating. People with anxiety, for example, who might get things like palpitations or sweating and their heart racing when they feel very anxious, they just get used to those feelings. So although they might still be having the symptoms of anxiety, it affects them less. So these are some really interesting mechanisms that are being explored as to specific benefits of physical activity when it comes to mental health. I said I'd talk a little bit more. I hope you're still with me with the science, but I said I'd talk a little bit more about systemic inflammation and why physical activity is protective. So this systemic inflammation is really, really bad for us. And physical activity, whilst it's complex and there are very, very many different ways in which it can reduce systemic inflammation, there are two main ways. The first one is that physical activity helps you build muscle. I spoke a bit earlier about the importance of muscle strengthening exercise, because muscle doesn't just give a pleasant aesthetic. It's not just good for our strength. It actually helps us reduce systemic inflammation. When our muscles are activated by exercise, they actually release anti-inflammatory chemicals. They're called myokines. And these chemicals actually help reduce systemic inflammation. The reason that things like aspirin and statins work so well is they are anti-inflammatories. So they reduce inflammation and can reduce your risk of things like heart attacks and strokes. But we can think of our muscles as our very own inbuilt little anti-inflammatory machines. The more we have, the more we use them, the more we release our own natural anti-inflammatories. That reduces systemic inflammation, that reduces our risk of disease, and also can reduce our stress levels and improve our mental health. And the second mechanism here is physical activity reduces visceral fat. Visceral fat, it's not the fat that's underneath the skin that you can pinch an inch. We're not too worried about that. That's subcutaneous fat. But visceral fat is the yellowy orange fat that's in and around the organs, deep inside. So if people have a big tummy, but the fat isn't under the skin, it's inside the body, that's the dangerous fat. That is kind of like an organ in itself, and it is very pro-inflammatory. It produces a lot of chemicals that increase inflammation. Now, you have to do quite a lot of physical activity to lose weight. So we're not talking about weight loss here necessarily, but you don't need to do huge amounts of physical activity for it to have an impact on your visceral fat, especially the fat that's inside the organs that can be very dangerous. So something like trying to aim towards 150 minutes a week, especially if you're not doing very much, will impact on the visceral fat in your body, will reduce your systemic inflammation, and will help to maintain your physical and your mental health. And if you're still with me with the science, I'm now going to show you some pictures of MRI scans. So what you're looking at here is on the left, there are 3 images. On the right, there are 3 images. The 3 images on the left are MRI scan slices of a person who has a BMI above 30. So clinically would be classed as obese, but they are metabolically healthy. And the person on the right has the same BMI, but somebody would be classed as metabolically not as healthy. So the top image is a slice sort of through the top of the abdomen. And what you can see there is anything that's bright white is either bone or it's fat. So on the images at the top, the white stuff around the outside, that's the subcutaneous fat. That's the fat under the skin. That's the fat we're not too worried about. But inside the body, the white stuff, you can see on the left, there's not so much of it. There's some around the kidneys, but that's normal. Whereas the image on the right, there's a lot of the white stuff inside the body. That's the visceral fat. That person's health is being compromised by the amount of visceral fat inside the body. Of the 3 images, the ones in the middle, we're now looking at the liver. On the right, you can see that it's smooth, the texture. Whereas, on the left, it's smooth, the texture, whereas on the right, you can see that's the appearance of a fatty liver. So there's fat inside the liver, which is compromising the liver's ability to do its job. And then the bottom image is a section looking through the leg, the lower leg. And you can see the one on the left is the dark stuff is muscle. The white stuff is fat. There's very little fat, whereas on the right, there's much more fat. And, people might think that a juicy, streaky steak that looks like that might be tasty, but trust me, it's not really what you want in your muscles. So what this is showing essentially is that these 2 people have the same BMI, but they have very different amounts of visceral fat. And we can't put everyone through an MRI scanner, but the point I'm making is if you increase your physical activity levels even though you might not be able to see it on the outside, please know that you're melting away the visceral fat on the inside. So it's doing you huge amounts of good. And then this slide is coming to that point of, well, how much physical activity do you really need to do? So whilst 150 minutes is amazing, if you can do it, actually small amounts of physical activity have benefit. What we're looking at here on this graph is across the bottom is increasing amounts of physical activity, and the axis going up is showing the years of life gained over the age of 40. So essentially the big green line is the 150 minutes. So this is saying that if you compare people who do nothing to people who do the 150 minutes, people do 150 minutes can expect to have an additional 3 years of healthy life. But the biggest gain is in those who are doing nothing to doing a small amount. In fact, those who go from doing nothing to doing 30 minutes. And you can get almost 2/3 of that gain, so almost 2 of those years, if you're comparing people who do nothing to people who do 30 minutes. So the point is, if you can get to 150 minutes, fantastic. As you can see, there are health benefits, even more if you go beyond the 150 minutes, but it starts to plateau off, so not as much. But if you can get from 0 to 30 minutes, that is really, really significant. And if you can get from 0 to 10 minutes, well, that is incredible as well. So trying to build up gradually to whatever is possible and achievable for you will give you health benefit. And those who go from doing nothing to something will benefit more than those who go from doing something to increasing. I want to talk just briefly about people who have long-term conditions when it comes to being active. I think sometimes there's this misconception that people who have long-term conditions don't want to be more active, but actually the data tells us that's not the case. So We Are Undefeatable are an incredible charity. It's a campaign that's led by 15 of the UK's top health and social care charities, and they've worked with their patients to find out, what they want to do when it comes to physical activity. And only 32% of people surveyed said that they were happy with the amount of physical activity they were doing. 61% of people, and actually 68% of those who had 2 or more long-term conditions, felt unhappy with the amount of physical activity they were doing and wanted to do more. That tells us that, people with long-term conditions, they want to be physically active, but there are some things that stand in their way. And these were the perceived barriers that people shared who had long-term conditions. Pain came out on top. So people are worried about or experience pain before, during, or after physical activity. Feeling tired was next, breathlessness, lack of motivation. Those were the top 4. But what's interesting is when you look at the top 4, actually being active is also the solution. So whilst it is a barrier, it can also be the solution. We know that physical activity is really, really helpful for treating lots of types of pain, especially things like osteoarthritis of the knees or the hips. That's not to say that you won't experience pain when doing physical activity, especially at the beginning, but it is also a solution for pain if you can do it, if you can persist with it as you move on. Once heard a really interesting orthopedic surgeon talk about osteoarthritis of the knee, and we know as doctors that when you look at an X-ray of a knee and you look at different X-rays that show osteoarthritis, there's often not a lot of correlation between how severe the arthritis looks on the X-ray and how severe the symptoms are in a patient. You could have an X-ray that looks almost normal and the patient has really bad symptoms of osteoarthritis, and you can have an X-ray that looks like really severe and the patient only has mild symptoms. So he said he doesn't believe that osteoarthritis is really a condition of the knee joint. It's a condition of wasted quadriceps muscles. So those are the ones on the fronts of your thighs that support the knee joint. When we see osteoarthritis of the knee, one of the things we see is reduced joint space. So the bones have come closer together than they should be. By strengthening the muscle above the knee, you can increase the space in the joint, and that can alleviate symptoms. And there was a study down somewhere in the southwest where the waiting times for knee replacement surgery was so long that a group of medical students did a study where they offered spinning, so cycling, indoor cycling, to people who were waiting for their surgery, and a significant number of them increased their leg strength. Their pain got so much better that they chose to come off the waiting list. So, pain's a tricky one, because whilst not denying that exercise can be painful, if you can find a way to do it and incorporate it and build up gradually, you can get to a point where it alleviates pain. But it might be worth considering having a chat with a physiotherapist or your doctor to see how best to do that. Again, feeling tired, we know that when you feel tired, sometimes the last thing you want to do is be active, but it's one of the best things to alleviate tiredness and improve sleep. Again, breathlessness, feeling breathless, especially if you have a condition like COPD, can really put you off exercise. But pulmonary rehab is the best treatment there is for COPD, and that is essentially exercise, again, supported, and lack of motivation. Again, the same is true. So those are my slides. I'm going to come back to the village hall. Let's come out of there. I'm back in the room. I'm just having a look at you. I can see some of your messages now. So I hope I didn't lose you there with the science. I hope you found that interesting. And what I want to do now is go on and talk a little bit about, well, what can you actually do? Hopefully I've convinced you that physical activity is important for not just physical health, but mental health as well. So I'd like to share some ideas for things that you can actually do to get started. And the important thing is, again, anything that you do that you weren't doing previously counts. And depending on who you are and what your fitness levels are and how active you are currently will depend on where you get started. But what I'd like to do is think about somebody who perhaps isn't doing any physical activity at all. Where can you start? The best place to start is probably in your own home, or just with walking outdoors and walking at a pace that feels comfortable to start off with, and gradually increasing that pace so that you can start to get a little bit more breathless. Is it safe to start exercising? For almost everybody, it is safe to start exercising as long as you start low and go slow. So start with something that feels comfortable and build it up gradually, whether that is walking, whether that is doing some stretches, whether that is doing some muscle strengthening exercises that I'm going to show you now that you can do while seated at home. Start low and go slow. And if you do that, it's safe. Anybody who has conditions such as heart problems, diabetes, kidney problems or breathing problems, if you feel discomfort when you're doing exercises or you're concerned, then do have a chat with your doctor first. But actually, for practically everybody, if you start low and go slow, then it's safe to get started. Let's start with that muscle strengthening exercise. I've got some classic I've actually got tins of tomatoes here, and I'm going to show you just a couple of things that you can do right now. You don't need to have tins in your hands, just with your arms, to get you started for upper body muscle strengthening. So you could do a shoulder press. So holding the tins here with your arms bent, and just push your hands up and down and up and down. And you can do it without a weight, you can do it with tins, you can do it with something heavier if that's really easy. You do that 10 times and do it 3 times a day, you'll start to build shoulder strength, particularly people who have upper back problems, neck problems, shoulder problems. You might not have a full range of movement, but just doing whatever range of movement you can, you might over time be able to increase that range of movement. So that was a shoulder press. The other one you can do is so my arms are now down by my side, straight, and moving them up towards the ceiling. Now this, again, there'll be many people who have shoulder pain, so don't push it. If you've got pain, don't push through the pain. Just do what's comfortable for you. It might be that you've just got a small range of movement that's comfortable. Again, over time, you might build strength and you might be able to increase that movement further. And the third one I'm going to show you is a curl. So bicep curl. So tins are out in front, down a little bit, and we're just curling them up. That's 3 upper body exercises that's going to build muscle, build strength. How can you remember to do it? What about when you're boiling the kettle? What about when the adverts come on, when you're watching TV? Lower body, there's one exercise I want to show all of you. And if you're able to stand, I want you to stand up right now. So just stand up. And I do this with my patients all the time. I demonstrate to them. And then sit down and stand up again. and sit down. If you need to push on something, hold on to something, do. If you don't, if you can do it without using your hands, then do it again. If you can do that 10 times, 3 times a day, you will build strength in your legs really, really quickly. And that is one of the best exercises that you can do. If you find that very easy, you can turn your chair sideways. And now what I'm going to do is I'm going to sit down, but I'm not actually going to put my weight on the chair, just touch the chair and then come up. And that's a squat. Again, it's something that you can do whilst the ad breaks are on. It's something you can do while the kettle's boiling. Another nice one in the kitchen is to do push-ups, but on the bench, on the kitchen bench, just do some push-ups. Or balancing, standing on one leg whilst you're brushing your teeth or whilst the kettle's boiling, holding on to something if you need to, but if you don't need to, even better. And a progression from that one for balance is doing the alphabet. So stand on one leg and hold on to something if you need to, but then with the foot that's in the air, draw the alphabet, and then switch sides with the foot that's up in the air, draw the alphabet. Do it holding on to something to start with. If you can then progress to do it without holding on to something and you want to take it further, the letters get bigger to the point where when your balance is really good, you can stand unaided and do really big, oh, there's my slippers, really big letters with your foot. Then that's great for balance. It's also a great muscle strengthening exercise. So that's just an idea of a few little things that you can do in the home just to start building muscle strength. If there's one exercise for aerobic, it's walking. Walking, for those that are able to walk, is something that's, it's just there, it's available, it's free. If you do it in nature, you have additional benefits. If you do it with a friend, there are additional benefits. It's a way of, even catching up with people on the phone or doing a Zoom call, but make sure you don't trip over. So that's the thing that's available. But other things that count as aerobic exercise are playing with children or grandchildren, cleaning the house. Simple things like if you do the hoovering, trying to up the pace at which you do the hoovering and put some music on so you can really get going. If you do that for 20 minutes, that is a workout. That counts as a workout. Hanging out the washing, that can be a muscle strengthening exercise, also an aerobic exercise if it gets you out of breath. So remember that all these things, anything that is bodily movement that requires an increased energy expenditure, it all counts. So you're all already doing some of it. How can you increase it? My top tips, 3 top tips when it comes to getting active and maintaining that activity. Number 1 is choose something that you enjoy. So if there was something that you enjoyed in the past, swimming, cycling, walking, football, if you enjoyed football and you want to get back into that, cheerleading, whatever it was you enjoyed in the past, thinking about doing something you enjoy. It might be that actually you really just enjoy being in nature. Maybe you enjoy photography, and combining your walk with a beauty spot where you can take some photographs. So choose something you like because you're much more likely to stick to it. My second tip is around, if you can, involve other people, because if you're doing it with a friend, with a family member, even if that is, the steps challenges that people do with their families where, they're competing against each other, it makes it more fun. It gives you added motivation. It makes you accountable. And my third tip is make it achievable. So, I've talked a few times about this 150 minutes today. It doesn't have to be 150 minutes. During my pregnancy, I gave myself the target of doing 10 minutes every day of something, whether that was walking, jogging, yoga, Pilates, anything that somebody's asked the question, does Pilates count as strengthening exercise? It does. It can do. There are different types of Pilates, but if it's a type of Pilates that makes your muscles feel a bit sore afterwards, often 2 days afterwards, it certainly absolutely counts. Pilates requires often holding your leg or your arm or your body in a certain position to the point at which it feels a bit uncomfortable. That's definitely counts as muscle strengthening, and often balance and coordination, and sometimes aerobic as well. So Pilates is a really great type of exercise. And what else? Oh yeah, so making it achievable. So in my pregnancy, I gave myself the goal of 10 minutes. Often when I left the house, I'd probably come back half an hour later. Sometimes I'd set off for a 10-minute walk, end up doing a 20-minute jog. But it's by making it achievable, you get yourself out there, you get yourself started. And often once you get started, you feel great. You want to carry on and do it for longer. So it might be for somebody watching that 2 minutes is what you choose. I'm going to do 2 minutes every day of walking, which means going outside my front door, walking to the end of the street and coming back again. That's fine. If that's what's achievable for you, don't aim too high, make it achievable. And then another tip, I know I said 3, but I've got a 4th one. My 4th tip is trying to build it into your routine. So remembering to be active. If we're busy, finding the time to be active, it can be really challenging. And often, if we're honest, let's face it, we've got so many things to prioritize that often all of these things we're talking about this week, the self-care, the physical activity, the mindfulness, the meditation, sometimes it slips to the bottom of the list. But if you incorporate the physical activity into your normal everyday routine, you do it automatically without thinking about it. You don't have to find the time to do it. So some examples would be, thinking about an active commute to work. It would be when you go to the supermarket, if you drive, making it a habit to park as far away as you can from the front doors. It could be that getting off the bus one stop early, taking the stairs instead of the lift. All these little things, if you make the pledge and make it your habit to always choose the more difficult option, which is difficult because actually as human beings, we will always choose the least path of resistance. But making that pledge that, from now on, I'm going to get the lift up the stairs, or even if you I'm not going to get the lift, I'm going to walk up the stairs. Or even if that's too much, choosing to walk down the stairs and get the lift up, or getting the lift up halfway and walking the rest. But, incorporating things into a routine is really helpful. Thank you so much.